We are very fortunate to have our clinic in LaGrange. We partner with the hospital and the health department. Our clinic is, we're very fortunate to have 5 volunteers, healthcare professionals, 2 physicians and 3 nurse practitioners who have held 10 clinics since we started, each seeing an average of 8 patients. Some see more, some see less. These volunteers and the nurses who assist them have been very, very faithful and helpful in seeing patients. These charts here are the patients that we've seen just in the last 2 weeks. We maintain files for a little over 800 patients. However, we could see many more patients. This is our appointment book, and this appointment book, as you can see, is full, and we have many, many, many pages of times we can't see any more patients. Our first available now, this is in October that I'm talking, our first available is not until January. So our fundraising goal this year focuses on being able to hire a part-time healthcare professional, probably a nurse practitioner, so we could have clinic every day. And then we could have off-site clinics in other counties, in other parts of this county. It would be too much for our volunteers to donate that much time. They come after their regular office hours, so it would just be marvelous if we could have this addition to our clinic situation.
I volunteer here at the clinic because I see the need on a daily basis working in the hospital of those that don't have health care and can't afford health care. And so this is a way that I can give back to the community through a service that I can offer that not too many people can.
It's a tremendous need here in Oldham County, and we do have individuals who come from Jefferson and Shelbyville also. I think it's important to be able to keep them healthy and help them to live good lives and as productive as they can with their health issues.
My situation is that I haven't worked for 2 years, and I had been, money's very hard for me to come by, and she told me about the community care clinic, and she made a phone call for me, and the nice lady called me back and got me set up with this appointment so that I could have physician care at a minimal cost, because like I say, it is very hard for me to even come by $5, much less $30.
The clinic originally thought that we would be treating more of your cough and cold type of conditions, pretty acute, but what I found is many individuals with much more advanced issues like diabetes and heart disease and hypertension who need our help. In fact, I guess the most enjoyable thing is the patients are very appreciative of the care they receive, and and the fact that we're here to help them.
I came in 3 months ago. I had a diabetic ulcer, among other complications of diabetes. First, we thought that I was probably going to have to lose some of my foot in order to stop the infection from spreading. And Dr. Kemp Rogers and the clinic itself helped me get the help that I needed, and now my foot is well on its way to recovery, and I probably won't lose any of my foot thanks to the clinic.
I know that the folks that we see are so grateful for the services they receive here, and I think about a quarter of our population do speak Spanish, and so personally the folks that I work with are very, very grateful for what they can get here at the clinic.
We know our patients appreciate being able to come to the doctor, and an example of this came very clearly to me when I went in one of the examining rooms to check it one morning after clinic, and I found this little note. This little note says, "Praise the Lord, I finally got to see a doctor." And that's what we're all about at HDB and the clinic. So as we grow the clinic and we look for sustainability in our funding, That's our focus.